Good morning. In this video, we will be discussing about galactose metabolism and its related disorders. When you see the structure of glucose and galactose, they differ only at C4. You can see here the position of hydrogen and hydroxyl group is just reversed at the C4 carbon atom. Such compounds are called as epimers, which means galactose is an epimer of glucose at C4 carbon atom. This galactose, which is an aldoexose, it can be formed in our body from two different sources. One is exogenous source, that means through diet, and the other one is endogenous source, which means the part which is synthesized in our body. In our diet, galactose is present mainly in the form of lactose and it is rich in milk. Lactose is nothing but a disaccharide made up of galactose and glucose linked by alpha 1,4 glycosidic linkage. When you consume this milk or any dairy product, the lactose in it will be first catabolized, will be digested by an enzyme called as lactase. Okay, and this free lactase will be releasing the free galactose molecule. This free galactose, like glucose, it will be absorbed through sodium dependent glucose transporter 1 but with relatively higher affinity. Okay, so here I would like to give you a small clinical significance. In some people, this lactase enzyme may be deficient. Okay, so in such patients, the lactose cannot be digested and it cannot be tolerated, leading to a condition called as lactose intolerance, which usually presents with abdominal pain, bloating, diarrhea and vomiting, especially within 30 minutes of having milk and other dairy products. Okay, so this is about the exogenous sources. Next, coming to the endogenous synthesis, within our body, galactose can easily be synthesized from glucose. Just now we saw that glucose and galactose are epimers of each other. So the enzyme epimerase can easily convert UDP glucose into UDP galactose. This is how galactose is formed in our body. Next, we will see about the catabolism of galactose. For glucose, specifically we have glucokinase. For fructose, we have fructokinase. Similarly, for galactose, we have a specific enzyme called as galactokinase within the liver. So this galactokinase, like any other kinases, it will be phosphorylating our galactose to form galactose 1-phosphate. This is the first step in galactose metabolism within the liver. Now, this galactose 1-phosphate form, it will undergo an exchange reaction with UDP glucose. What is that exchange reaction means? From glucose, the UDP molecule will be transferred to galactose, whereas from galactose, the phosphate molecule will be transferred to glucose, resulting in the formation of UDP galactose and glucose 1-phosphate. UDP glucose will react with galactose 1-phosphate to form UDP galactose and glucose 1-phosphate. So this reaction, which involves the transfer of UDP molecule to galactose 1-phosphate, is catalyzed by the enzyme galactose 1-phosphate uridyl transferase. So this is the second enzyme which is involved in galactose metabolism, galactose 1-phosphate uridyl transferase. Now, the glucose 1-phosphate thus formed, it has three different fates depending on the blood glucose level. Suppose if the blood glucose level is very low, in such conditions, the glucose 1-phosphate will be utilized for gluconeogenesis. That means for glucose synthesis. Glucose 1-phosphate will be converted to glucose 6-phosphate by the enzyme mutase, and that glucose 6-phosphate in turn will be converted to glucose by the enzyme glucose 6-phosphatase, which is specifically present in the liver. Okay, so this is what happens when the blood glucose level is less. Suppose if the blood glucose levels are sufficient enough, okay, under such conditions, the glucose 1-phosphate will be oxidized by glycolysis. Glucose 1-phosphate will be converted to same glucose 6-phosphate, and that glucose 6-phosphate will be oxidized through glycolytic pathway. And the third fate is, suppose when the blood glucose levels are at very excess level, okay, in such conditions, the glucose 1-phosphate will be used for glycogen synthesis. This is the fate of glucose 1-phosphate. When blood glucose levels are low, it will be used for gluconeogenesis. When it is normal, when it is optimal level, it will be oxidized and by glycolysis. When it is in excess, when the glucose levels are in excess, it will be used, the glucose 1-phosphate formed from galactose will be used for glycogen synthesis. Okay, coming to the other part, UDP galactose. This in turn also has three different fates. The first one is it can be used for lactose synthesis. Okay, so when we need lactose, especially during the lactation period. Okay, so during the end of the pregnancy and during the lactation period, so what will happen means an enzyme called as lactose synthase will transfer a glucose molecule to this UDP galactose and results in lactose synthesis. Okay, so this happens during the late pregnancy and during the lactation time. Whereas the other time, the UDP galactose can be utilized for synthesizing glycolipids, glycosaminoglycans and various glycoproteins. Okay, so for all these things, our UDP galactose will be utilized. After serving all these functions, if there is excess UDP galactose, by epimerization reaction by the enzyme epimerase, it will be converted again to UDP glucose, and that UDP glucose will be stored in the liver as glycogen. Okay, so this is the fate of UDP galactose, and this is how galactose is metabolized in our body. Okay, so now we will see about few disorders which are related to this galactose metabolism. To start with, there are actually two main enzymes involved in the glucose catabolism. What are those two enzymes means? The first one is galactokinase and the second one is galactose 1-phosphate uridyl transferase. When the enzyme galactokinase is deficient, we call it as type 2 galactosemia. In this autosomal recessive disorder, when galactokinase enzyme is deficient, galactose cannot be metabolized in our body. So they will be accumulating in the blood and the same will be excreted in urine, leading to galactosemia and galactosuria. Okay, so in addition to this galactosemia and galactosuria, the patients of these disorder, they will be typically having cataracts and mental retardation. Okay, so why these two, why lens and brain cells are affected means, the biochemical reason behind it is the galactose, when it accumulates in these two tissues, they will be reduced by the enzyme aldose reductase to form its corresponding alcohol called as dulcitol. So this dulcitol, because of its osmotic property, it can cause damage to the lens leading to cataract, and it can cause damage to the brain cells leading to mental retardation. Okay, so these are the two characteristic features you will be seeing in any galactose metabolism disorders. Next, other than galactokinase, the second important enzyme involved in the galactose metabolism is galactose 1-phosphate uridyl transferase. When this enzyme is deficient, it leads to a condition called as type 1 galactosemia, or otherwise called as classical galactosemia. In this autosomal recessive disorder, when the enzyme galactose 1-phosphate uridyl transferase is not there, it's when it is deficient or absent, two things will be accumulating. One is the galactose will be accumulating. Apart from that, galactose 1-phosphate will also be accumulating. So when galactose accumulates, it leads to galactosemia, galactosuria, cataract and mental retardation. All these features will be there. But when galactose 1-phosphate starts accumulating, it will inhibit the enzyme glycogen phosphorylase, actually, which is the rate limiting enzyme in glycogen breakdown. Okay, so that enzyme will be inhibited. If that enzyme is inhibited, glycogen cannot be converted to glucose. So it leads to excess accumulation of glycogen in the liver, leading to hepatomegaly and jaundice, and decreased production of glucose, leading to hypoglycemia. Apart from inhibiting this enzyme glycogen phosphorylase, the galactose 1-phosphate in excess, it can also cause renal tubular damage, and it can interfere with the excretion of amino acids, reabsorption of amino acids, leading to amino aciduria. So most of these clinical features like hepatomegaly, jaundice, hypoglycemia, renal tubular damage, amino aciduria, so all these, most of these findings you can also see in fructose metabolism disorders. But the main difference is in galactosemia, this galactosemia, you will be seeing all these features immediately after birth. As soon as the baby starts his feeding, they will be showing all these clinical manifestations. Whereas in fructose metabolism disorders, it will happen only after 6 months during the time of weaning. Okay, so this is the major difference between galactose metabolism disorders and fructose metabolism disorder. Nowadays, in most of the countries, galactosemia has been included. The diagnosis of galactosemia has been included as a part of neonatal screening. Okay, so when you diagnose it at the early stage, what you can do is you can prevent all these complications by giving the patient lactose-free diet. Okay, so that milk, that means milk and milk products should be restricted in their diet. Okay, so how long this restriction should be continued means it is not lifelong. It can be continued for some 4 to 5 years. After that, what will happen means liver itself can synthesize an enzyme called as galactose 1-phosphate pyrophosphorylase. So this enzyme galactose 1-phosphate pyrophosphorylase, they will be converting galactose 1-phosphate into UDP galactose. Okay, so actually just now I said that most of the clinical features of galactose metabolism disorder is due to this accumulation of galactose 1-phosphate. Okay, so that is the reason for hypoglycemia, hepatomegaly, jaundice, renal tubular damage, abenoaciduria, etc. Okay, so all these can be prevented by this enzyme galactose 1-phosphate. Liver by age of 4 to 5 years, liver will start producing an alternate enzyme which can metabolize this galactose 1-phosphate. Okay, so till then you have to restrict the milk and milk products. Okay, so that's it about the galactose metabolism. So to sum up, so galactose, it can be formed from two sources. One is from milk, we can get it. Alternatively, it can be synthesized in our body from glucose using the enzyme epimerase, because glucose and galactose are epimers of each other. So this galactose which is entering into our body, it will be metabolized mainly in the liver by the enzyme galactokinase and galactose 1-phosphate uridyl transferase. Okay, so in this, if galactokinase is deficient, it leads to the condition called as type 2 galactosemia, whereas if uridyl transferase enzyme is deficient, it leads to type 1 galactosemia, or otherwise called as classical galactosemia. Okay, thank you.